A typical visit to the doctor is about 15 or 20 minutes. In such a limited amount of time, people often find it hard to share embarrassing matters with their doctor. But don't worry, we got you covered. There's a new discreet way to talk to your doctor about those personal matters without ever stepping outside of your house. Our good friend dermatologist Dr. Sonia Batra is here to discuss it. Hey, Dr. Batra.
Hi, Dr. Ian. Thanks for having me.
Always good to see you. Always good to see you. So listen, you're a dermatologist, so you have tons of different types of patients, and you also have male patients, and they tend to be embarrassed about lots of things, including discussing skin issues.
Absolutely. And so with my male patients, anytime they think it's something that might not be perceived as masculine a topic, like skincare or frown lines, I think they always kind of either try to couch it, like maybe their wife or a friend brought it up with them. They just always kind of show a little bit of embarrassment, and there's a little hesitation there.
How do you make your patients feel comfortable?
I always try to couch conversations that everything is fair game and just try to be non-judgmental when people bring things up with me. I try my best to just listen and then present them with options. And I think especially men are very excited when there's actually a treatment option or a plan.
So what else are men uncomfortable talking about?
Well, I would say probably the most common topic that a man will bring up with a little bit of embarrassment or a little bit of hesitation is probably hair loss.
Yeah, well, voila, case A right here, exhibit A. So, but life is life, right? I mean, I say to people all the time, like, there's certain things in life you can control, certain things you can't control, certain things you're born with. But, really, there's a difference between losing your hair and actually going bald. And people should understand that there is a difference. Help us work through how we can see if it's really going bald or just hair loss.
Sure. And so you're right. This is an incredibly common issue. About 25% of men start going bald around the age of 30. And when we talk about hair loss versus baldness, when we're talking about going bald, it's usually genetic, and the formal name for it is actually androgenetic alopecia. And what that means is that over time, from the coarse, dark, pigmented follicles we're used to seeing on the top of the head, there's actually a miniaturization process where they become the fine, non-pigmented vellus hairs. So the follicles actually get smaller and smaller, and to the point that you can't really see them, and that's what we perceive as baldness. The difference is hair loss is often more of a generic term, and we talk about when people are shedding more. We may talk about other conditions that contribute to hair loss. It's not necessarily that recession at the temples, thinning at the top that we classically associate with sort of male pattern baldness. In either case, it can be treated, but I think it's psychologically really distressing when men start to see themselves going bald. And so I always tell my patients, the earlier you initiate some regimen and some intervention, the more hair you're going to preserve, the more follicles you're going to rescue. So it's going to be even more effective if initiated early. And the good news is for both hair loss as well as for genetic pattern baldness, we do have medications that are really effective. There are topical options that sometimes don't even need a prescription. And then for a prescription option, there's an effective FDA-approved medication called finasteride.
Dr. Batra, modern technology allows patients to really get the care they need for some of these embarrassing problems completely, via remote. For issues like hair loss, with Exuma Wellness, you can replace the doctor's office and pharmacy visits with a virtual consultation. That's often as simple as filling out a questionnaire and uploading your photos. Then a board-certified physician will review, diagnose, and prescribe the medications to help you look and feel your best. And these medications are shipped right to your house. So you can also talk to a doctor about these prescriptions for maybe erectile dysfunction and even acne treatments too. The whole process, I love it. It's quick, simple, private, and safe. Right, Dr. Batra?
Yeah, and I think right now people really should be staying home unless it's a really essential or an emergent situation. So this is a nice option.
Dr. Batra, as always, thank you for your great information. Looking forward to having you on the show again soon.
Thank you so much.
Of course, to learn more about Exuma, you can visit getexuma.com or just visit our website, thedoctorstv.com.